So on your tracker, starting from left to right, we're going to go through each one of these columns. The first column is how to open a chart. So you can highlight on the patient that you want to open the chart, and you do so by clicking right on the name. And then you click on the box right here. So anywhere in this box, or you can click on open chart on the right hand side, whichever one you prefer. And then this will bring you into a work list of all the things that we have to document. So I'm going to go back to the tracker, and then you can see that I have Test Dave's chart open because you see that little icon of an open folder. The system will allow you to have up to 5 charts open at a time. So a good habit to get into is to close the charts that you're not using, and you can do that by just clicking on this icon at the bottom that says close all charts. The next column is your location. So you can view where your patient is, and you can also change the location. So for Test Dave, I'm going to bring him from the waiting room, and I'm going to click right in the WR, and I'm going to choose the pod that I want to go to. So as you can see, there's people in every single one of the rooms in pod 1 because there's a count of 1. So I'm going to go to pod 2, and I'm going to choose a location where there's nobody in the room, so I know that this room is open. So room 11, I'm going to click save, and it's going to update the tracker. In order to put Dave back into the waiting room, you're going to click back on the name on the waiting room. You're going to click on wait areas over here in the top, and you're going to click on WR, and that will put the patient back into the waiting room. The next column is your patient's name, their last name followed by the first name. Anytime you have a last name that has the same 3 letters, it will highlight the last name just as a layer of safety so that you can see there's patients with similar names in the department. The next column is the patient's age and gender. Males are in the blue, females are in the pink. If you ever have a patient who you don't know their gender, if they're either a transgender case where we don't know what legally they are, or injuries are so severe that you don't know if they're a male or female, you can choose an unknown, in which case this box will be yellow. The next column is the emergency severity index. This will be filled out by the RNs when they do their triage assessment. So as soon as they do their triage, it will reflect on the tracker. The next column is the chief complaint. 52 chief complaints to choose from, and this will also be done by the RN so that you no longer have to choose a chief complaint when you recept the patient. The next column is your isolation status. If the patient is on standard precautions, we're just going to leave that blank, so you don't technically have to put anything in this box. But if the patient is on an isolation, we can change it right from this screen. So we're going to highlight on the patient and click clinical data on the right hand side, and scroll down to the isolation column. And if there's something in there that you want to change, you can just backspace and then click F9 or drop the little triangle and choose whatever isolation you want, and then save, and that will update your tracker. We will have access to Meditech Magic for us to view only so that we can verify multi-drug resistant organisms, MRSA, VRE, or any other infectious disease that we want to flag. The next column is the lab, blood bank, and microbiology. We kept the colors that we're used to now, so when we have a new order, you'll have a red check mark. When the order is done and in process, you'll see this blue icon with pending. And when the results are back, you will see this green check mark, and you can go ahead and click into this box when the results are back and view the results. The next column is your radiology column. Anytime you have an ultrasound, an x-ray, or a CAT scan, you'll see this low lit camera. Once the test is done and we are waiting for official results, you'll see this pending icon as well in this section. And then when the results are back, this camera will turn into a dark blue. The next two sections are the treatments and EKG sections. So anything that you sign off in your work list when you've completed, so whether it's orthostatics, a visual acuity, a finger stick, an EKG, whatever you document done in your work list, it will reflect on the tracker with a green check mark. The next column is the provider section. So you will see the attending's last name on the first row, followed by the PA's last name on the second row, followed by the RN's first name on the third row. Then you have your status column. The status will be changed in the background with all the documentations that's done by the nurses, MSTs, doctors. So it's the same names that you're used to now. So when the patient first arrives, it'll say arrival, then triage, then registered. You have a medically cleared section, a pending admission, the bed reserved once you put in a bed request, place in observation, and MD done, which is the same as we have now. But again, you won't have to change this at all. It's done in the background as you complete tasks. The next line is your length of stay. So this is hours and minutes. These patients have been here for a long time because there are test patients. Then you have a service. So for a patient who is admitted, you will see what service they are going to. So for example, for patient Rob, he's going to med surg. Otherwise, it would say tele or ICU or psych. And then once the supervisor puts in a bed assignment in the bed board, it will reflect on our tracker. So the MSTs no longer have to put bed assigned to room 180, bed 2, because it will reflect on the tracker and everybody could see it. The next column is your visit count. This will tally up the number of times the patient has come in the last 30 days. The next column is a comment section. This is for communicating among the staff. It's not part of the medical record, but it is discoverable. So if you ever have this patient's chart go to court, you can see the comments that we've put in the background. So we want to just make sure that you keep it professional and only put things that are appropriate. So for example, on Rob, I have his name highlighted. So the comment on him is NPO. If I wanted to see Adam's comment, because I see that there's a little bubble there, all I have to do is highlight on him, and the box just says comment. To change it, you would just click in that box, and it brings you to the comment section, so you can text whatever you want here. And save. And then that comment will display on this bottom section. The next column is where you can see that there is admission orders placed by the hospitalist because you have a little yellow flag there. So when you see the little yellow flag, you know that there's admission orders, and then you see this admit as patient routine and admit observation patient routines, so that you know that you can go ahead and put in a bed request. If you don't see this flag, you can go into the order section and just look for holding orders or your code status order, diet orders, so you know those are admission orders, and go ahead and request your bed. The next column is the sepsis column, which will just alert you that there a sepsis alert or septic shock, and the information here will pull through the nurse's assessment, from the nurse's assessment. So whatever they answered, whether the patient had a fever, a suspected source of infection, if they have any mental status changes or abnormal vital signs, this is where it will alert you. And then the last column is a restraint section, so you can see that this patient had restraints ordered at 1946. The last feature that I want to show you on the tracker is if you have a patient highlighted, the box on the bottom of the screen reflects that patient. See test Dave. This will pull the last set of vital signs that you've documented, their IV location, any comments that we had put in this category here, whether visitors are allowed, which you would have documented in your secondary assessment, and their account number. So just a little bit of information that you can see or access at a glance without having to open the chart.